This video I'm going to focus on some major vessels in the head and neck region. I do have a separate video where I went over mainly the arteries, like on this model. So I do want to start here, though. We can see these three arteries, and these would be the three branches off of the aortic arch. So this first branch off the aortic arch is the brachiocephalic trunk. Then here we have the left common carotid, and then the left subclavian. So you can see this is the left subclavian. It started here, originated on the aortic arch. Now, before I move on to the veins, there is one other artery, and I'm going to come back here, but I want to let's orient ourselves a little bit. So from the common carotid, you have the external carotid and you have the internal carotid. And I have a separate video talking about the circle of Willis, which is the brain supply, the blood supply to the brain that would originate partially from the internal carotid. The external carotid, one of the branches is the facial artery. Now I've removed the mandible so I could see those a little bit better, but here you can see the facial artery that will snake over the mandible. So if we come back to this model, you can see the facial artery here, and then this would be the facial vein. So now we're going to focus on the veins. These large veins here, this is the internal jugular vein. This would be the right internal jugular. This would be the left internal jugular. And then this smaller here, this is the right external jugular. The left has been cut, so we don't see it. So internal jugular, external jugular. Those drain into the brachiocephalic vein. We do not have a brachiocephalic trunk. We had that for the arteries, but the veins, we have a right brachiocephalic vein, and over here we have a left brachiocephalic vein. We also see the left subclavian vein. The left subclavian vein here, underneath the clavicle, subclavian. You would also have a right subclavian. It's not labeled, but the right subclavian. So the subclavians, the jugulars, the external and internal jugulars, they would drain into the brachiocephalic. So this is the right brachiocephalic. Once again, this is the left brachiocephalic vein, and those would empty into the superior vena cava, which would go into the right atrium of the heart.